after the confirmation of diagnosis, what shall we do to deal with the disease? The patient needs treatment. WHO recommends that people diagnosed with HIV should be offered and linked to antiretroviral treatment as soon as possible. Antiviral drugs can slow progression of disease. Thus far, antiviral agents targeting virus replication cycle steps include 1. Binding fusion penetration inhibitors, or 2. integrase inhibitors, or 3. protease inhibitors, or 4. the nucleoside analog reverse transcriptase inhibitors, or non-nucleoside reverse transcriptase inhibitors, or 5. CCR5 antagonists. The drugs are used as a part of a multi-drug cocktail. We call it as highly active antiretroviral therapy, HAART. In most cases, HAART combines the use of 3 or more anti-HIV drugs from different classes. A good example is the usage of 1 integrase inhibitor and 2 nucleoside analog RT inhibitors, or 1 non-nucleoside RT inhibitors and 2 nucleoside analog RT inhibitors. The combination therapy can reduce drug resistance, decrease plasma viral load, and greatly slow death rate. However, HAART cannot eradicate the virus and cure AIDS. The viral reservoirs are hard to overcome. Sometimes intermediate treatment for pre-exposure prophylaxis or post-exposure prophylaxis is also suggested. It may significantly reduce the odds of infection. Pre-exposure prophylaxis is the latest addition to expand combination prevention options for people at high risk of HIV infection. Post-exposure prophylaxis is a course of antiretrovirals administered within 48 to 72 hours after exposure to HIV-positive blood or genital secretions. Due to the high expense, the strict adherence, and side effects, universal application of HAART is difficult. The best option to stop spread of AIDS is a safe and effective vaccine. The question is, why haven't we gotten AIDS vaccine by now? There are many challenges in development of an ideal vaccine. The first, HIV mutates rapidly, creating a moving target for both immune response and any vaccine design. The second, the persistent viral reservoirs are hard to eliminate. The third, the vaccine must be designed to elicit neutralizing antibody and cell-mediated immunity effectively, avoiding the immunity-mediated pathogenesis at the same time. In addition, good animal models for testing these vaccines are limited and expensive. Anyway, we hope that the scientists take an intense effort to devise, test, and deliver a safe and effective vaccine for AIDS ultimately. HIV/AIDS has claimed millions of lives worldwide. It's a significant task to control the disease, hopefully to end the epidemic. What approaches can we take to cope with the task? The essential and effective way of control HIV infection is by educating the population about the method of transmission and the preventive measures. For instance, monogamous relationship, safe sex, no needle sharing, strict infection control procedures in blood banks, and healthy care practice. A successful anti-HIV education campaign in some developing countries has been cited as effective as antiviral drugs for saving lives. There are other ways such as overall safety of blood and blood products, circumcision, national monitoring. People testing positive for HIV must not donate blood. Circumcision of males reduces the risk of infection. The national monitoring and cooperation has helped to campaign for global prevention. On the whole, in order to defeating HIV/AIDS, UNAIDS proposed one of the strategies, getting to the zero. Zero new infections, zero discrimination, zero AIDS-related death. Although the goal didn't reach by 2015, the campaigns are still on the way. Through paying ways for prevention and education programs around the world, expanding drug access programs, speeding up vaccine development, strengthening the cooperation, etc., ending the AIDS epidemic is possible. At this time, we have finished all the key contents of HIV. Here are main summaries in the table. You can review them and connect the learning objectives for further comprehension. Finally, there is a case for you. Draw a mind map to analyze the case. Here is the list of the reference books and the websites cited. Thank you for your attention.